Hi, I'm Dr. Watt, the healthy neurosurgeon. I want to talk to you about the blood tests that your doctor really ought to do, but probably isn't doing. Now, I've said before, and I'll say it again. No doctor gets up and says, today I think I'll do some crappy medicine. Today I think I'll hurt some people. But they do what they're trained. They do what they're used to doing. And unfortunately, in the world of third-party payers, they also do what gets reimbursed. So a number of these tests I'm going to mention are not on a routine blood panel for two reasons. One, your doctor's probably never heard of them and quite frankly might not know what to do with them even if he had the result. And number two, there's a good chance that Blue Cross or Kaiser or Aetna or whoever you're dealing with would say, thanks, but no thanks, we're just not going to pay for those. So what's the list? First off is fasting insulin. Most people, if they go in for an annual physical, they get their fasting blood sugar done and they get their hemoglobin A1C, which is the 3-month average of excess sugar. And unfortunately, in mainstream medicine, the A1C is looked at to determine are you or are you not diabetic, and mainstream medicine ignores the fact that A1C can be at a level that's producing damage to your body that's very unhealthy, but isn't bad enough to qualify as being diabetic. Insulin is the hormone that your body makes in response to sugar in your system. And if you're chronically exposed to excess sugar, excess simple carbohydrates, your body's cranking out insulin all the time, trying to get the sugar out of your bloodstream and into your cells to use it as fuel. And unfortunately, when you're cranking this insulin out all the time, the cells in your body literally stop listening to the signal. They develop what we call insulin resistance. Insulin resistance tends to happen well before type 2 diabetes. It's related to metabolic syndrome. It predisposes you to a host of problems, not least of which is heart disease. Elevated levels of insulin is actually a predictor of atherosclerosis and cardiovascular disease. So you want a fasting insulin level, and ideally you want your fasting insulin level at or below 5. To go along with your A1C being at or below 5.1, not in the diabetic range. Mainstream doctors love checking cholesterol levels. The heart doctors are all in love with cholesterol drugs, and they tend to say the only good cholesterol is no cholesterol. But they look at more common, older tests, HDL, LDL, triglycerides, total cholesterol level. Two cholesterol tests that are actually more predictive of heart disease than LDL, the historically bad cholesterol, are apolipo-B and lipo-A. Lipo-A tends to be strongly genetic. It's hard to move that number, although it tends to respond to niacin. But getting that one done at least once in your life tells you whether or not you are predisposed to have problems related to your cholesterol. So it's worth knowing. And even the mainstream doctors are coming around now to say apolipo-B is probably a better predictor of whether cholesterol is getting into the lining of your arteries than LDL. So you don't want to settle for just an LDL and an HDL and a total cholesterol. You want an apolipo-B, and at least once in your life, a lipo-A. Speaking of heart disease, as I alluded to already, cholesterol is not the whole story. Well, what else is a factor? Inflammation drives atherosclerosis. It also drives osteoarthritis. It drives dementia. It drives cancer. Chronic elevated inflammation is bad for us. So the test you want is a high sensitivity CRP. And ideally, you want that below 1. If your CRP is high, it doesn't tell you why it's high. It just tells you you have inflammation. But if your CRP is through the roof, then you need to figure out why is it high and figure out what you can do to address the underlying causes. A related substance is homocysteine. This is one that mainstream doctors virtually never check. Elevated homocysteine is a huge driver of atherosclerosis. It's a predictor of heart disease. High homocysteine also impairs brain function, and it's usually a reflection of B vitamin levels. If your homocysteine is very high, usually something as simple as taking good quality B vitamins will lower the homocysteine, protect your brain, protect your arteries. Your doctor may or may not get an iron level, but a test that's, if anything, more important is your ferritin level. Now, Ferritin level by itself, you need a knowledgeable person to interpret that for you. A high ferritin level usually means liver inflammation. Again, it doesn't say why it's inflamed. Is it hepatitis? Is it fatty liver disease? Is it from too much alcohol? You don't want elevated ferritin levels. On the other hand, ferritin also reflects your iron storage, and very low ferritin levels usually reflect a functional iron deficiency. Most people with very low ferritin levels are really dragging and tired all the time, and it's because they're iron deficient. Another factor that is a contributor to heart disease, but usually isn't thought of in those terms, is uric acid. Uric acid triggers gout attacks, so you don't want a super high uric acid because gout's not a lot of fun, but it's also a vascular risk factor. And again, you don't know whether or not you need to be doing something to address uric acid unless you test for it. Then come all of the hormones. And doctors are notorious for not wanting to test hormones because usually they don't want to do anything about them. Your good hormones, the guys that you want to have, they tend to peak around age 25 and gradually get lower and lower and lower, producing steady detrimental effects on your health. With women, it tends to be much more impressive with menopause. When they get slapped by the drop in estrogen and progesterone, they feel like crap. But these other hormones like testosterone and DHEA can produce symptoms in men and women. And the problem is the symptoms of the deficiency tend to creep up on you so you don't notice it. And your mainstream doctor says, well, what do you expect? It just goes with age. The two hormones that you don't want high levels of, one, I've already mentioned, insulin, and the other one is cortisol. Cortisol is your stress hormone. Now, it's vital that you be able to produce cortisol when it's needed, but cortisol and stress are kind of like your in-laws. When they move in, the longer they stay, the worse it gets. So you don't want a high cortisol level chronically, because if you're running a super high cortisol level, ignoring the fact that's a reflection that something is stressing you out and we ought to address the stress, eventually your adrenal glands that make the cortisol just become exhausted, and then they can't produce the amount that you need. It's called adrenal fatigue. My analogy is if you push the accelerator pedal to the floorboard and you keep it there, eventually smoke starts coming out from under the hood. So you want a morning cortisol level. You want it done in the morning because cortisol levels fluctuate throughout the day. A really in-depth evaluation of cortisol actually looks at cortisol at different times in the day, but a first in the morning cortisol level at least gives you a snapshot of where you stand. You've heard me say before that vitamin D is vitally important to you as a hormone. The test is actually 25-hydroxy vitamin D, but you don't have to ask for it by that name. You can just say, I want my vitamin D level. Thyroid is a vitally important hormone, and unfortunately, mainstream medicine tends to look at a test called TSH, thyroid stimulating hormone. This is the signal your brain sends to your thyroid to say, hey, where's our thyroid? Make more of it. The problem is TSH can vary quite a bit. And what you want is to have not just a TSH, but a free T3 and a free T4. T3 and T4 are the actual hormones themselves. And this gives you better insight into whether or not you have a thyroid deficiency or problem. Big guns are testosterone, estrogen, and progesterone. People tend to think of testosterone only as a male hormone, but it's vitally important for women as well as men. It's just men have higher levels than women. But as we have birthdays, our levels tend to decline, and that has negative effects on our health. And how do you know if you need to have your testosterone level fixed? You have to test it. Estrogen is also very important for men and women. Most guys don't realize just knowing your testosterone doesn't tell you the whole story. You want to know what your estrogen level is also. And it's the same story as with testosterone, just opposite. The ladies have higher estrogen levels, the men have lower estrogen levels, but there's still a healthy zone for both men and women. So you want your estradiol, your estrogen level tested. One just for the women is progesterone. Progesterone doesn't have a big play in men, but it's vitally important for women, because what counts in a woman's health is not just her absolute level of estrogen or progesterone, it's whether or not these two hormones are in balance. So you want to look at both of them. Progesterone in women, I'll skip it in a guy. DHEA, dihydroepiandrosterone, that's the other hormone that your adrenal gland makes. This is another one that we make less of with time. It's a mild androgen. It supports our bones. It supports our immune system. It's very important for brain health. It tends to peter out with birthdays, and if you don't look, you don't know. Probably the last hormone to peter out in people as they have birthdays is your growth hormone. Now, it's very hard to measure a growth hormone level. It's made in little short pulses, and it has a tiny half-life, and we make more of it in our sleep than we do during the day. So it's difficult to measure that one. But in your body, the growth hormone goes to your liver. Your liver turns into something called insulin-like growth factor 1, IGF-1. That kind of does the heavy lifting anyway, and it has a nice half-life on it, so you can measure your IGF-1 level. This is important because low IGF-1 is going to impair your ability for your body to heal from injuries. It's also going to predispose you to things like osteoporosis and sarcopenia. So this is certainly not a comprehensive list. If you said name every test that can be done, we'd be here all day. And certainly there are some tests that are worth getting in some situations and frankly aren't worth getting in others. But these ones I just listed really are foundational to looking at your health. And that's assuming that you're getting things like a CBC and a blood sugar and electrolytes, the Kim panel that your doctor would normally do. But it's just important to realize that your CBC blood count and your fasting glucose level and your sodium level doesn't tell you the whole story. So if you want to be healthy and you want to be proactive about your health, you want to test all of these different things so that you can look for any problems and then make a plan to address problems before they turn into symptoms. We want to do health care, not disease treatment. That's just not brain surgery.